Once you've approached an incident and you've checked that you're safe, the next thing we need to do is check response. There are 3 ways of doing this. Talk to the person, touch the person, and then put pressure on the collarbones. It's a small pain stimulus. So the first thing you want to say when talking to them first, keep still, don't move, wake up, open your eyes. We're saying keep still in case they have a traumatic injury. If they don't wake up and open their eyes and respond to us, then we need to tap on the shoulders with the back of our hands. This is so it doesn't look like you're assaulting the patient. Wake up, open your eyes. My name's Andy, I'm a first aider. Can you hear me? Wake up. So I identify myself as well when I'm doing that. And that identifies myself to everybody else who's standing there. Bearing in mind, this could be a public place and you might not know this individual. So, voice first, then touch, then pressure on the collarbones. If they are just asleep, they should wake up at this point. If they don't, then they are unresponsive. We now need to open the airway. Put 2 fingers under the chin, hand on the forehead, and tilt the head back. Then check the breathing for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. A 10-second check for normal breathing. An adult should breathe at least twice in those 10 seconds. If they do not, call an ambulance immediately. Use your speakerphone. Get a bystander or go yourself if you have no phone or helper. Activate 999 and say where you are and that you have an adult or child as appropriate who is not breathing normally. We would begin CPR as soon as possible once 999 is activated. I would always recommend exposing the chest at the beginning of the CPR so there's no delays or stopping the CPR later. So I'm going to expose the chest, and now I can see where to put my hands above this point where the ribs meet, so in the middle of the chest bone. Put the heel of one hand straight down in the middle of the chest bone, the heel of the other hand on top, and lift the fingers up off the ribs. Knees back, shoulders forward, arms straight. So use your body weight, and we're going to do 30 chest compressions. I was attempting to do 30 chest compressions at approximately 120 beats per minute, which is 2 per second. You may have been taught to do it with songs in the past. They are 100 beats per minute. At First Responders Limited, we teach at 120 beats per minute. Somewhere in between is acceptable. Once you've done your 30 chest compressions, pressing about 5 to 6 centimeters on an adult's chest, we would then open the airway and do 2 breaths, if you're willing to do so. If you're not willing to do so, continue with chest compressions, do not stop. And that's actually quite good because it means that I can do chest compressions and talk to somebody else about calling the ambulance and getting the AED or using my speakerphone. Continuous chest compressions, hard and fast, go, 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 don't stop. If you are willing to do the breaths, open the airway again, pinch the nose shut and do 2 breaths. 1 and lift off, 2 and lift off. Side step back to the chest and then back into 30 chest compressions. So adult CPR is 30 chest compressions and 2 rescue breaths. Keep going until either the person wakes up and tells you to stop themselves, moving their arms and legs, breathing normally and says, get off my chest. 2, the ambulance crew come and they set up their kit and they tell you to stop. You can stop when you're handing over to another first aider. We'd recommend every 2 minutes. Even an untrained person could help you. You could tell them how to do the chest compressions. If you're absolutely exhausted and there's no one to hand over to, you're allowed to stop. And also, there could be danger as well. Hope you enjoyed this video. Let's go on to the next one, use of an AED.